Hello, I'm Hinda Najem. I'm an MD, and I work as a postdoctoral fellow in Dr. Amy Heimberger's lab at the Neurological Surgery Department at Northwestern University. So the fundamental differences between the Luna-4 Comet multiplexing immunofluorescence system and the other multiplexing technique is within how they stain the antibody. So in the previous techniques, they stain all the antibodies, they use the secondaries, and then they image at the end. With this technique, they have a microfluidic system where they have the ability to stain two primary antibodies at a time. They stain, they add the secondaries, they image, and then they elute. So you can go up to 20 cycles, 40 cycles, depending on how many antibodies you can stain. So the advantage of the Luna-4 Comet multiplex system in comparison to other multiplexing techniques. So for example, previously we had to build a 7-color panel, and then each primary antibody had to be conjugated with its secondary and its specific fluorophore. And then the panel took us about 4 to 6 months to build. And to interrogate multiple scientific questions for one project, we needed to rebuild multiple panels and customize multiple panels at a time to be able to interrogate or to have answers. Now with this system, especially with this you get very high resolution images with a lot more markers that are integrated within one panel. So we're using only 2 secondaries, 2 fluorophores, and with this system that is cycles of imaging 2 antibodies and then elution, you'll be able to interrogate in one panel, very sophisticated panel, a lot of scientific questions related with one project. So within this system, it's it's repeated cycles of 2 primary antibody staining, secondaries, and then the elution. And on each cycle, they do a DAPI counterstain. So the DAPI counterstain actually highlights the nuclei of the cell, and all the images will have the same DAPI counterstain after each cycle. So at the end, all the nuclei will be aligned in one image, and then you'll stack all the rest of the antibodies. Let me give you an example about how much complexity can we interrogate on one cell. For example, this is a macrophage that is expressing the CD68 marker. And then this macrophage has been validated within the tonsil tissue. And we can see that this macrophage is highly activated by expressing the CD8 marker as well as interferon gamma. So with single cell techniques or with single cell sequencing techniques, the tissue we get, especially the human tissues you get, they're not perfused. So all the immune populations you are actually taking from the tissue can be within the vessel as well as within the tumor microenvironment. So the spatial technique will allow you to visualize are these T cells actually within the tumor core, or are they only within the blood vessels? You can detect a lot of T cell clusters with different functions within the single cell techniques, but the spatial analysis can actually validate the location with these T cells. For example, I turned on here the T cells in white, and you can see as I interrogate the tissue, it's very hard to find these T cells. And if I'm scanning the whole tissue within the tumor microenvironment itself, within the tumor core, it's really hard. Maybe there's one over here. It's really hard to locate these T cells. But if you zoom in on some blood vessels that are delimited by the CD31, you can visualize a lot of T cells that can be located within the blood vessel itself.